Heart attacks are a leading cause of death worldwide, but many are preventable. Knowing the warning signs can be the difference between life and death today. We're going to explore 7 crucial signals that often precede a heart attack. Understanding these signs empowers you to take proactive steps towards protecting your heart health. Let's delve into these vital indicators. The first sign, and perhaps the most well-known, is chest pain or discomfort. This isn't always the classic crushing feeling depicted in movies. It can manifest as pressure, tightness, squeezing, or a dull ache in the chest. This pain might radiate to the left arm, jaw, neck, back, or even the upper abdomen. It's important to pay attention to any unusual sensations in these areas. Secondly, shortness of breath is a significant warning sign. This could present as difficulty catching your breath. Even during rest, you might feel winded after minimal exertion or experience a sudden onset of breathlessness. Don't dismiss this as simply being out of shape. Sudden, unexplained shortness of breath warrants attention. Third, discomfort in other areas of the upper body can also be indicative of an impending heart attack. This could include pain or pressure in the jaw, neck, back, or one or both arms, often accompanied by sweating or nausea. These symptoms might be subtle, easily dismissed as indigestion or muscle soreness, but they shouldn't be ignored. Next, we have excessive sweating. This isn't just a light perspiration. We're talking about sudden, unexplained heavy sweating, often accompanied by other symptoms like chest pain or shortness of breath. This profuse sweating is your body's way of signaling a problem. Number 5 is nausea or lightheadedness, feeling queasy or dizzy, especially in conjunction with other warning signs. Should trigger immediate concern. These symptoms are often related to the body's response to a lack of oxygen reaching the heart. Sixth, unusual fatigue is a potential indicator. This isn't your typical tiredness. After a long day, we're talking about extreme fatigue, a debilitating exhaustion that is out of the ordinary and persists even after adequate rest is persistent. Overwhelming tiredness deserves attention. Finally, the 7th sign is an irregular heartbeat. This could manifest as a rapid, fluttering, or pounding heartbeat, or even as a feeling that your heart is skipping beats. If you experience palpitations or notice an unusual rhythm in your heartbeat, it's crucial to seek medical advice promptly. It's crucial to remember that these symptoms can occur individually or in combination. The intensity of the symptoms can also vary. The key takeaway is that any unusual or unexplained discomfort in your chest or upper body, especially when accompanied by other warning signs, requires immediate medical attention. Don't hesitate to call emergency services. If you experience any of these symptoms, early intervention is crucial in improving outcomes after a heart attack. Delaying treatment can have severe consequences. While these 7 signs are common indicators, they aren't exhaustive, and some individuals may experience a heart attack without experiencing any noticeable symptoms. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and managing stress, is vital in reducing your risk of heart disease and heart attack. Regular checkups with your doctor are also essential for monitoring your heart health. Now, let's delve a little deeper into understanding the nuances of these symptoms. For instance, that chest pain, while often described as pressure or tightness, can be incredibly varied. Some individuals experience a burning sensation, others a sharp, stabbing pain. The location and intensity can also differ significantly, making it crucial to pay attention to any unusual feeling in your chest, back, or arms. Want to learn more about the different ways chest pain can manifest itself in heart attack? Like this video and subscribe for future health insights. It's vital to recognize these variations. Furthermore, shortness of breath isn't always dramatic. It might be a subtle feeling of being slightly winded, even when resting, or it could be a noticeable difficulty breathing during routine activities that you previously managed easily. This subtle change in your breathing pattern should never be ignored. A significant shift in your usual breathing capacity warrants immediate attention, especially when paired with other symptoms. We often overlook the significance of nausea and lightheadedness. These aren't necessarily the intense vomiting and dizziness depicted in some media portrayals. Subtle feelings of queasiness or slight feeling of imbalance could be early warning signs. Think about it. If you're experiencing these alongside chest discomfort or shortness of breath, it's definitely a reason to seek medical help immediately. Learn more life-saving tips. Like, comment, and subscribe for future health updates. Don't miss out. Excessive sweating deserves further clarification. We're not talking about a light perspiration from exercise. We're referring to a cold, clammy sweat that appears unexpectedly and is often profuse. This is quite distinct from the usual warmth you might feel after physical activity. This unexpected heavy sweating, coupled with other symptoms, is a critical signal. The unusual fatigue we mentioned earlier is often described as an overwhelming tiredness that doesn't improve with rest at the deeper, more profound exhaustion than your typical post-workday tiredness is a type of fatigue that leaves you feeling completely drained and unable to function. Normally, understanding this distinction is key. Finally, irregular heartbeats can be tricky to recognize. Not everyone experiences a dramatic pounding heart. Might be a subtle fluttering, a skip beat, or a feeling of racing heart. The key is recognizing any deviation from your normal heart rhythm. And you know what your normal feels like, right? If you notice something different, even slightly, seeking medical attention promptly is crucial. This is why regular checkups are so vital. Remember, the combination of symptoms is just as important as the individual signs. Even if you only experience one or two of these symptoms mildly, and they persist or are accompanied by a feeling of unease, you need to address the situation promptly. Early detection and immediate medical attention drastically increase your chances of a positive outcome. Don't delay. Your health is priceless. So, we have explored 7 key warning signs that can precede a heart attack. Chest pain that can manifest in various ways, from pressure to sharp stabbing, shortness of breath, ranging from subtle windedness to significant difficulty breathing, nausea and lightheadedness, often subtler than calmly portrayed, unexpected, profuse cold sweats, overwhelming fatigue that doesn't improve with rest, irregular heartbeats, from fluttering to racing, and the crucial interplay of these symptoms. Remember, the intensity of each symptom can vary greatly. It's not always a dramatic scene depicted in movies. The subtle changes, the persistent unease, the combination of seemingly minor symptoms. These are all crucial indicators. Ignoring these subtle warning signals can have serious consequences. A single symptom might be easily dismissed, but a combination or even persistence of a single symptom warrants immediate attention. Your body is trying to communicate with you. Listen to it, don't. Wait for a major event to seek help. Early detection saves lives. We've highlighted the critical importance of recognizing these precursors, not just for yourself, but for those around you. Learning to spot these signs can be life-saving for you and perhaps for someone you love. Want to learn more about preventing heart attacks? Like this video and subscribe for future health insights. Remember, time is of the essence when it comes to heart health. Learn more life-saving tips. Like, comment, and subscribe for future health updates. Don't miss out. What steps will you take today to prioritize your heart health? The answer to that question could be the most important one of your life.